Good evening and thank you for being with us. Long-term care workers and local health advocates gathered outside Mini Queen's Park today to protest the conditions in Ontario's seniors' homes, including those here in Thunder Bay. The rally was part of a province-wide effort to lobby the Ford government to give workers the time and wages they need to properly care for Ontario's seniors. Ryan Bonazzo has the story.
The staff are overworked and they have been for years.
Standing behind a row of tombstones representing more than 1,900 people who have died in Ontario's long-term care homes, members of the Thunder Bay Health Coalition and long-term care workers themselves have a message for Premier Doug Ford.
His response to the deaths of 1,935 residents, 9 staff and 2 family members is absolutely insufficient.
The Ontario Health Coalition is demanding that the Ford government take immediate action to recruit and train more full-time staff, implement a minimum care standard of 4 hours per resident per day, and put an end to for-profit long-term care.
I stand here representing all frontline workers.
Lena Moore has been a personal support worker for 15 years. She doesn't want to publicly name her employer, saying only that she works at one of the largest LTC homes in Thunder Bay. She says she's only able to spend about 6 minutes with residents in a day before moving on, knowing that person's basic needs haven't been met.
It's an awful feeling. It breaks my heart. I went into this profession wanting to take care of people, looking after residents, looking after elderly people. That's why I came into this profession.
Staff in long-term care are passionate people. They're compassionate people. They want to help people living in long-term care. They just don't have the time.
The Premier's made a lot of promises. He's committed to fixing long-term care. We're absolutely frustrated that nothing's been done.
The problems long predate this PC government. Unions also lobbied the Liberals for years to fix long-term care. But with the pandemic comes a new level of urgency and anxiety. While Thunder Bay has yet to experience the full effects of COVID-19 that have been felt in other parts of the province, Moore says she's terrified about this second wave.
We can't lose any more lives.
Ryan Bonazzo, TBT News.
Meantime, Ontario's patient ombudsman is recommending a number of reforms to the long-term care system as the province deals with a resurgence of COVID-19. The office began a formal investigation into long-term care in June after receiving hundreds of complaints in the early days of the pandemic. Colin DeMello has more.
Ontario's long-term care homes were devastated by COVID-19, leading to more than 1,800 deaths in that sector alone. And even today, even during the second wave, there are still questions about whether or not it's prepared. During the height of the pandemic, as long-term care homes were being ravaged, Ontario's patient ombudsman was flooded with complaints.
So we actually started seeing a big increase in complaints from long-term care back in the spring.
586 complaints were made between March and July about long-term care. Family and staff had alerted the ombudsman about visitation, infection prevention and control, communication, quality of care, and staffing issues.
So from residents, we were hearing things about, being in a room, sharing a room with somebody who was positive when they weren't positive. And from the staff themselves, we heard concerns about not feeling that they were being trained properly to either do infection controls and also being taught how to take on and take off all of the personal protective equipment.
At Queen's Park today, the plight of those in long-term care took center stage.
The Ombudsman is joining a chorus of people calling for urgent changes. When will those changes be in place?
Our government has been committed to the safety and well-being of long-term care residents. We will stay focused and we will get this job done. Thank you.
But advocates say the situation is still precarious as Ontario experiences outbreaks once again in long-term care.
We're still seeing hospitals having to take over homes because they're not prepared for infection control, and we don't have the staffing, we don't have the training in those homes. And when you only have one nurse and no doctor on staff at any time, so the doctors come and go, how can you have a proper infectious disease plan?
The patient ombudsman also made a number of recommendations that every long-term care home should have a partner hospital or municipality to assist, up-to-date training for staff on infection prevention and PPE, dedicated resources for communication between long-term care homes and families, and enhanced whistleblower protection for healthcare workers. The Ford government has already implemented a new visitor policy for long-term care homes and COVID-19 hotspots. Now, only essential visitors and essential caregivers will be allowed to enter those homes, while outdoor socially distanced visits can also continue as well. At Queen's Park, Colin DeMello, CTV News.
A new trial date has been set for 21-year-old Braden Bushby. The long-awaited trial was supposed to begin next Tuesday, but had to be pushed back after an electrical fire shut down the city courthouse this past weekend. Bushby is facing charges of manslaughter and aggravated assault in connection with the infamous trailer hitch incident in January of 2017. 34-year-old Barbara Kentner died in hospital 5 months after she was struck in the abdomen by a metal trailer hitch thrown from a moving vehicle. A case conference was held today where the lawyers agreed to reschedule the case for November 2nd to the 6th. This is the third time the trial has been delayed, first because of jury issues, then by COVID-19. The Crown and defense arguments will now be heard by judge alone after originally being planned as a jury trial. Local survey results on cannabis consumption and the feelings towards the drug since legalization are now available. The Thunder Bay District Health Unit and the city's drug strategy have released the results of their 2019 survey. And now the two agencies can use that knowledge to help answer any questions many people have and are curious about. Corey Nordstrom has more.
It wasn't until March 2nd of this year that Thunder Bay saw its first recreational cannabis shop open up. But when the nearly 1,900 people in the Thunder Bay District took part in the Drug Strategy and District Health Unit survey, it was a sure bet that soon the product would be on local shelves. Sheena Albanese is a health promotion planner with the health unit. Although the final study just came out, they have already utilized some of the information they received.
We used the survey information to tell us who people want to hear from and what they want to learn about. So we did an event around edible cannabis products. We did something around law and impaired driving, cannabis impaired driving.
And the stats show that for those who use cannabis, it may be both for the good times and the not so good times.
And we asked about recreational use versus use for medical purposes. And what we found is there's a lot of overlap between those two. So, you know, the boundaries between medical use and recreational use are, they're blurred. They're not exactly two different spheres.
While the survey obviously didn't include all in the district, it did find that most who used cannabis in the previous 3 months were using almost daily. There were also many who sought out information on marijuana's impact on mental health.
It's not a surprise, but it was something that we really have to pay attention to, that mental health is and this was long before the pandemic hit us, but mental health was a really top of mind for a lot of people who are wanting to learn more about cannabis or who use cannabis.
Albanese says because the pandemic has taken a toll on the mental health of many individuals, it may be worthwhile to study a change in cannabis use over that time frame. Corey Nordstrom, TBT News.
A total of 8 people are facing charges following a pair of drug raids in the North Thunder Bay area Wednesday afternoon. A Thunder Bay man and 2 Southern Ontario residents were arrested after a raid on a Cornwall Avenue home turned up crack cocaine, fentanyl, and cash. Around the same time, a search warrant was executed at a Macker Avenue address where fentanyl and cash were also seized. In this case, a man and a woman from Thunder Bay and 3 Toronto men were apprehended. All 8 are facing drug trafficking charges. On October 14th, the Thunder Bay Public Library will enter into the 6th and second last phase of their reopening plan. This phase will allow patrons inside the libraries for the first time since the doors closed at the start of the pandemic. In Phase 6, a screening process will be in place at the entrance to all 4 library branches for anyone wanting to enter and use the facility. A selection of grab-and-go materials will now be available, and a reader's advisory service for those who need help selecting their next item will be reinstated. Free, no-contact faxing, scanning, and photocopying will also return.
Well, you can imagine the staff are very excited to be interacting with patrons inside the building again. We know patrons have been very understanding and very patient with us. It's still going to be very far from normal, to be honest, when people get into the library. You know, the whole space isn't opened up. There's going to be like a restricted space, and there's going to be restricted services because we're still making safety for patrons and staff our #1 priority. So it won't be anything like the normal library experience of the past where you could come in, just roam around the place.
Each library has a limit on how many people can be in the building at any one time, and those limits will vary for each branch. Internet and computer services are not part of this phase of the reopening. Those will come in phase 7. Officials at Eco Superior are encouraging kids to walk to school during the month of October to promote healthy and active lifestyles while helping the environment. Also known as Walktober, Walker Wheel Thunder Bay is delivering the program this month. At a kickoff event this morning, a group of walkers headed to a Cole Grand Morgan with staff from Eco Superior leading the way. Caroline Cox is the agency's environmental program coordinator. She says walking or wheeling to school not only improves the overall safety of the school zones, but there are added benefits for parents and kids.
With walking and wheeling, we promote 5 main advantages. So there is the physical health, obviously, which we all know about, but there are also huge mental health advantages, huge benefits for attention and alertness at school. So there are a lot of studies that show a link between walking or wheeling to school and better academic performance.
The Walker Wheel Project runs active programs all year long, including a winter walk day in February, active April, and a bike month in the summer. Dalico Anishinaabe Family Care launched its annual Step Up fundraising campaign this week to showcase Child Abuse Prevention Month. And like most things, this year's fundraising will look slightly different. The 11th annual Step Up campaign is once again reminding the community about the well-being of children and youth in Thunder Bay. With October being Child Abuse Prevention Month, the executives at Dalico created a new and safe concept to ensure the message will still be relayed despite the pandemic. Dalico's John Dixon says this year, more than ever, it's important to step up and make children and youth a priority.
This year's been a little bit different with the pandemic. We've kind of kept it to a virtual platform this year. We're offering a lot of opportunities for families to engage and do things together. There's a window decorating activity that we're going to be doing and putting out there for a contest where people can decorate their front windows and kind of commit to stepping up as a community. Take that picture, post it to our Facebook for a chance to win some prizes.
Backers of the initiative are encouraging the community to participate by decorating their windows with positive art and by wearing purple on October 22nd. And Eco Superior and the City of Thunder Bay are looking to beautify the city while also making it a cleaner, healthier place to be. Today marked the launch of the first ever Spring into Fall cleanup campaign. Usually, the two partners join forces when the snow starts melting. But the 24th Spring Up to Cleanup was pushed back due to the pandemic. So now, Eco Superior is hoping to reduce the city's litter before the snow falls. And in this unusual year, they're asking people to do their cleanups solo rather than in the usual groups with dozens of others. Eco Superior's Melissa Davidson says each piece of garbage off the street can directly help the ecosystems of Lake Superior.
The negative impacts of litter are really quite prominent here, especially anything that goes into the storm drain in Thunder Bay goes straight into Lake Superior. So that's really, we're trying to make sure that that doesn't happen to keep our lake clean and healthy.
Businesses and community members can register for a free cleanup kit on the Eco Superior website. The campaign runs all month long.
Not a bad day for a fall cleanup.
It certainly would be, yeah.
Pretty nice out. Fiona, I did some Thanksgiving errands this morning.